Welcome to Inflammatory Arthritis and its treatments. This module, Module 5, is on vaccination. My name is Carolyn Wiskin. I'm a clinical pharmacist working at Charlton Health in Hamilton, Ontario. When I first started working in the area of rheumatology, it became evident that many people who have this increased risk of infection, having an autoimmune disease, were not getting their adult vaccines updated. People already on treatments that might increase their infection risk were not getting their vaccines. And certainly when we look at the milestone times in life where we should be getting vaccines done, such as everyone age 50 getting their shingles vaccination, everyone age 65 getting their pneumococcal or pneumonia vaccines, these were being missed even in individuals in the public that had no health risks, let alone people who had autoimmune diseases, who might need these vaccines at an even earlier age than the general public. So I had a lot of work to do. As a result, I was able to put together some vaccine checklists and protocols that have been used in areas all over the province and in fact in many areas across the country. So I'm really excited to be sharing some of this information because I think it's so important that we can prevent many diseases through vaccines, and we want to take advantage of that. People with active disease who have high levels of inflammation, who have rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, will have a higher risk of pneumonia than the general public, a higher risk of shingles than the general public, and a higher risk of getting influenza, the flu, than the general public. As a result of that, we want to vaccinate. And we like to vaccinate as soon as we're aware of somebody having this increased risk. Many people feel that, it's the treatments that are really increasing my risk of infection. In fact, it's the condition itself, carrying that high burden of inflammation. So a person who's flaring, who has high levels of their autoimmune disease, who is not doing well, not sleeping through the night, your risk of infection is greater than the person who is on treatment and well controlled. The other thing to keep in mind is that prednisone, which we often use at times of flare, and people often like the effects of lowering of inflammation that it brings, it really isn't a drug we want to use long term because it increases infection risk even more than our biologic therapies. So knowing that an autoimmune condition increases risk means that we need to be even more vigilant about updating our adult vaccines than we would be in the general public. And even in the general public, we would say we've got to do a better job. We reduce infection risk by giving treatments that control disease and by giving vaccines. So when should vaccines be given? The ideal time to update your vaccines is 2 weeks before starting any disease-modifying treatment. So that means when you're first diagnosed with an autoimmune condition, before starting methotrexate, before starting leflunomide, any of those conventional treatments, get your vaccines up to date. It's not just the treatments that increase risk, as I mentioned, it is the condition you have itself, and so getting these updated is a really great thing. On a conventional disease-modifying treatment, on an advanced therapy, if you haven't given them ahead of time, any non-live vaccine can be given without the need to delay treatment at all. But there is one exception to this. Methotrexate can blunt the benefit of the influenza vaccine. That's your flu shot. And other vaccines. So where possible, if you didn't vaccinate before starting methotrexate and now you realize, yes, I'd like my pneumonia vaccine, I need my flu shot. When you give that vaccine, if you can, hold the next 2 doses of methotrexate for the next 2 weeks and you will get more value out of that vaccine. But you do not, for any other biologic or swallowed treatment that is disease modifying, need to stop or hold it due to any safety concern or effectiveness concern. You would just go ahead and give the vaccine. Methotrexate is the exception, not because of safety, because it blunts the benefit. So you get a little more efficacy if you hold the 2 doses after vaccinating. Now, live vaccine's a different story. When we give a live vaccine, it may require you to hold your disease-modifying treatment for maybe 1 dose or 2 doses, depending on how often you give that treatment and what vaccine, the live vaccine that you're going to be administering. So if it's a live vaccine, this is something you do need to discuss with your rheumatologist in terms of the need to hold your
disease-modifying treatment. So which vaccine should you consider? And I certainly would say that the annual flu shot or influenza vaccine is a must. The high-dose vaccine is what we recommend for anyone 65 or over. And this is provided at no charge, the influenza vaccine annually through public health, distributed to family physicians as well as community pharmacies. There are 2 different pneumonia vaccines. We don't need to give these annually like the flu shot. We just do one series of Prevnar 13 first, covering 13 types of pneumonia, and that's followed by something called Pneumovax, which covers another 10 strains of pneumonia. It's given at least 8 weeks later. And I will tell you in terms of public funding that anyone age 50 or over who's immunocompromised can get complementary Prevnar 13 and Pneumovax through the publicly funded supply to your family doctor. Prevnar 13 for people younger than age 50 is something, if they're even if they're immunocompromised, that you would have to pay for out of pocket or through private insurance. Pneumovax has always been free to adults at any age of risk. The shingles vaccine has a non-live and a live version. Our newer non-live version is Shingrix. And because it has greater efficacy and is non-live, it is the one that we would recommend. It's 2 doses, 2 to 6 months apart. This vaccine is only publicly funded, in other words, distributed to your family doctor for people between the age of 65 and 70. Everyone else who should get this vaccine is certainly recommended to everyone once they turn age 50. And with people with autoimmune diseases, we may even consider it at an earlier age. But the only age that it is free through the government supply is people 65 to 70. The tetanus vaccine we have as a combination actually with tetanus, diphtheria, and pertussis, which is why it's called Tdap. That should be updated every 10 years. Again, a non-live vaccine. And hepatitis B, along with A, especially for people with traveling, this is a combination called Twinrix. And one series, which is a series usually of 3 doses, does give you lifelong protection, and you do not require to ever repeat it. There may be other vaccines based on circumstance of travel, based on age. In other words, people going away to university or living in dormitory settings who might want to get their meningitis vaccines. People who did not get it in school at a younger age may want to update HPV vaccines. So there's other things that you may want to consider, but these in particular are ones that I think everyone should be looking at. I do want to briefly mention that when it comes to pneumonia, and I mentioned the pneumonia vaccines being so important, that there are many people who have increased risk of getting pneumonia, certainly by being immunocompromised, by having certain medical conditions, which could be heart disease, lung disease. And for some of you, you may have just age alone at being 65 or over. So for anyone who is identified with an autoimmune condition or has asthma, COPD, diabetes, as soon as we identify these risks, we are giving the pneumococcal protection. So those 2 pneumonia vaccines, Prevnar, and 8 weeks later, Pneumovax. Age alone would tell us everyone 65 and over should get this vaccine, but at 25, if we identify these risks, we are giving it. In the case of shingles, we refer to as herpes zoster, this is a really nice chart that just again shows based on different conditions. The first column is a healthy individual, and then in the next column we see SLE, systemic lupus, the next one inflammatory bowel disease, the next column rheumatoid arthritis, then psoriatic arthritis, psoriasis, ankylosing spondylitis, gout, diabetes. In all of these areas, when you look down at the relative risk of getting this, you will actually see these numbers being extremely high, much greater than what we would see in a healthy individual. If you go down to age 51 to 60 in this chart, you will see that the risk of 5.8, which is age 51 to 60, is when we start immunizing the public. And yet someone 3 columns over, for instance, who has rheumatoid arthritis, would have a higher risk of 5.8 in a much younger age. And so this is why, even though this shingles vaccine is officially approved in Canada for people 50 and over, we are actually vaccinating at a younger age, and that's just because the risk is greater. Many clinics have developed their own little cheat sheets, checklists for patients to look at all the vaccines that may be required in adulthood, how often they should be given, what is publicly funded. This is an example of one we've developed in our own clinic that can be helpful. I also want to give you the suggestion that you can go online and you can sign up for the Can Immunize app, which will allow you to record any vaccines you or your family have had. It will give you reminders when boosters are required, and it's a really nice way to keep track of your vaccines. The biggest thing is to be asking the question about what you need to have updated, and to realize the importance of us being able to prevent disease, because the last thing we want to have happen is you get an active infection, which would mean that your next dose of biologic has to be held until your infection resolves.
We are very fortunate to have many vaccines that can prevent disease. We don't have a vaccine for everything, however, so don't forget that good hand washing is really vital. Staying away from people who have active infection. And at times when the infection risk in our entire community is large and masks are being suggested, make sure you follow those recommendations. It is a time where vaccine preventable diseases are really important to be protected against. So make sure that you maximize on that opportunity. And know that you can have multiple vaccines at one time. So when you are getting your annual flu shot, you can safely receive a shingles vaccine, a pneumonia vaccine at the exact same time without any problem. I hope that you've enjoyed this series on inflammatory arthritis and its treatments. If you're only listening to this particular one on vaccines, know that there are 5 modules to this series, and it has been my pleasure to share this information with you.